The first question that comes to mind when somebody has a tremor in his hands or in his legs is whether it's Parkinson's disease. Most usually, it is not. All tremors are not Parkinson's disease. Parkinson's disease has some other symptoms like slowness of movement, like stiffness of the limbs, difficulty in walking and balance, which are much more important and which are much more debilitating for the patient than mere tremor. Now, Parkinson's disease is something that is not curable, unfortunately, just like diabetes. But just like diabetes, we can control symptoms, and the patient can have a happy and productive life for a pretty long period. And it might surprise you to know that many famous people, including statesmen, people who run the countries, they have suffered from Parkinson's disease and they have gone about their jobs with with some degree of success. So a diagnosis of Parkinson's disease does not mean a death sentence. You can have a productive life with proper treatment and is well controllable with modern medicines. And when medicines fail, there are also surgical interventions that can be done in certain cases in late stages, and people do respond well to treatment. Apart from Parkinson's disease itself, there are also lots of other tremors which are usually familial. They have to do with drugs that you take. Sometimes if you have a lot of breathing difficulty, you may have tremors. So tremors itself do not signify Parkinson's disease. They are all amenable to treatment, and they can, just like I said before, you can have a productive life even with your tremors and unfortunately if you have Parkinson's. The point is to get yourself treated at the earliest, consult a specialist. You can come to Charna. There are eminent neurophysicians here who will take care of your problems and we will guide you in the best way to deal with your ailments.